right. Welcome, everybody. Welcome to UAB Student Town Hall. We have a really packed agenda today. We took your feedback and we are bringing forth some of our experts, our medical experts, to talk to you today. So without further ado, I will go ahead and hand it off to our president, Dr. Ray Watts.
Well, thank you very much, Rosie. Welcome, everyone. We want to keep our students as well informed as possible about COVID-19, the UAB community, testing and safety practices, and related important items. We want you to have the best educational and other opportunities on campus as possible. But to do this, we need to make sure that we're keeping our UAB community safe. As Rosie said, your feedback has been taken seriously and has reshaped the format of this town hall. And we are providing important content experts to help you understand the public health issues that must influence and help guide our decisions. So next, I'll pass it off to our Undergraduate Student Government Association President, Tyler Wong. Tyler?
Thank you, Dr. Watts. Good evening, everyone. My name is Tyler Huang, and I currently serve as the student body president of the Undergraduate Student Government Association. Echoing Dr. Watts' opening remarks, I want to welcome you all tonight to this town hall. I'd like to begin by commending all of the students for their valiant efforts to progress through one of the most complex periods in higher education and public health. They say that college is one of the most difficult experiences within itself, and this semester alone has demonstrated how rigorous this journey can be. As students, we have overcome so much already, and while it may seem that the negatives of this pandemic are emphasized over the positives, as a student first, I have deep admiration and respect for the efforts that we as a student body at UAB have been able to demonstrate. Our resilience and ability to flourish in a higher education model outside the competing forces of the outside world demonstrates a core component of our UAB creed, the Blazer Way. Our creed emphasizes the tenets of honor and integrity, two constructs that are evident in our health promoting efforts as a student body. Blazers continue to hold themselves accountable to the highest degree, and we represent and support the complex communities that each of us are intertwined within. As we progress toward the end of this academic term, it is important we sustain this momentum. I want to remind you to continue to show your Blazer spirit. Let us continue to lead the nation in our public health efforts by staying 6 feet apart, washing our hands as we approach the holiday seasons, own responsibility to keep ourselves and our community safe, and lastly, by correctly wearing our masks to ensure the continued health of our friends and relatives. We can continue to lead the race to minimize the spread of COVID in all aspects of our life if we unite together in these last few weeks of this term. I have the utmost faith in our ability to curb the effects of this pandemic at a local, state, and national level. And as I close, I want to take the time to express my gratitude to the administration and professional staff at UAB for leading this important discussion tonight. I hope that the structure and messaging from tonight's town hall can provide to you all a better line of transparency for future directions that the university is heading towards as we close out this semester and make appropriate plans for the upcoming term. As always, as student body president, I will continue to strive to advocate on behalf of the student body to address key concerns to enhance the student experience at UAB. Thank you. And now I'd like to introduce the next speaker tonight that will kick off tonight's town hall with an important message surrounding student mental health. It's my utmost pleasure to introduce Veronica Mixon. Veronica is a senior majoring in African American Studies and Psychology with a certificate in mental health. She's the president of the African American Studies Organization, a member of the Student Counseling Advisory Board, and on the Suicide Prevention and Leadership Task Force. Veronica has received the Leader in Mental Health Literacy Award by Cognito, which is awarded to students who have impacted their campus through mental health education. Veronica, the platform is yours.
Thank you for welcoming me. As you said, I'm Veronica, and I'll be touching on ways that you can cope during this time, as well as ways we can manage our mental health and wellness. Next slide. So 2020 has been a lot of things. A lot of students have felt like it's been 3 years in 1 year, and the year isn't even over yet. So we've had to deal with transitioning from being in person to being hybrid to being online, and also handling things within society, like voter registration. That's been a huge topic right now that's been very stressful on students, especially students who are first-time voters during this presidential election. And then on top of that, we've also had injustices put onto the Black community that's been happening for quite a long time, but social media has been highlighting it. So a lot of students have been forced to see media trauma with racial injustice, as well as just hate crimes and things like that going on in media. So not only are we trying to navigate being a student, we're having to navigate being an activist, as well as just trying to make time for ourselves during all of this. So this will focus on essentially wearing how you can manage all the hats at one time and even transitioning in between hats. Next slide. So with that, the best way to show that is also owning responsibility that you have within this climate. So that can be staying 6 feet apart, washing your hands, recognizing that the things that you do not only impact your health, but the health of other people around you within the UAB community. And not just UAB as an institution, but the Birmingham community as a whole. And that also rolls into you wearing your mask and wearing it properly, remembering to put it above your nose and not under your nose. Next slide. So with self-care, essentially these are activities that allow you to have a moment of de-stress, regarding your busy schedule. So this can look like coloring, listening to music, things of that nature. But in regarding to self-care, we have to recognize that it's non-negotiable. A lot of the times, since we're managing everything during 2020, we forget to remember that we actually need to take time to take a breather, to take a moment to reflect on things that are going on and to reflect on ourselves and what things we need to help progress in a healthier manner. And this will also help it where by having self-care activities, you're able to not only manage your own mental health, but also manage your schedule as a whole, because it'll put everything in perspective and allow you to have a sense of balance in your daily schedule. Next slide. So within self-care, there are 5 components of it. The first is self-compassion. So that looks like allowing yourself to have self-love. So giving yourself the space to reflect on the things that you're doing as well as reflecting on the things going on, but also allowing yourself to take a breather and be like, okay, so I can step away and take a break. Or, oh, I don't have to handle this now. I can come back to it later. Just giving yourself a sense of forgiveness to allow yourself to indulge in things for you. The second component is getting enough sleep as well as getting good sleep. So this can look like maybe taking your phone away and charging it in another room instead of having it near your bed at night. Or even as small as turning your TV off and not having electronics on at all. Because I know sometimes it's hard to sleep when you have everything going on and you might want to go watch Netflix, but maybe instead play some like soothing music to help you fall asleep. So that way you can go to sleep early and wake up for your classes in time, or even wake up feeling a little bit more refreshed. The third would be have a healthy routine in place. So this can also connect with your studies. So essentially maybe start waking up at like 9 in the morning, making breakfast on time before you log into your Zoom class, or even waking up in the morning to go for a run, making it where you're actually scheduling out your day. So that way it doesn't feel like everything's being piled up on top of you and you have no time, when in actuality, you have 24 hours to kind of manage everything that you're going through in that one day. The fourth would be make physical activity a priority. So this is essentially similar to incorporating some type of way where you can get outside or be active, or maybe even be inside and do yoga for 30 minutes. There's a lot of free platforms that have meditation, yoga opportunities, as well as some like easy exercises that you can do at home or in your dorm space. And the last one would be looking at what you're consuming. So this can be looking at your eating habits. So maybe instead of getting that bag of chips, you can go for something that's like crackers, or maybe going for nuts or something that's a healthier alternative instead of stocking up on junk food. Because I know when you're stressed out, and I know myself when I'm stressed out, my first thought is, oh, let me go get a Hershey bar, or let me go get this piece of chocolate. But instead, there's healthier alternatives that allow you to have a little bit more balance regarding to like what you're consuming during this stressful time period. Next slide. So my final list is just some ideas of like self-care. So when we look at self-care, sometimes we think it has to be like a big activity that takes up a lot of our time, when essentially it can be something as small as going for a walk, or even I used to go to the green and take a blanket and sit out there and study and play music. And that way I'm 6 feet apart from people, I have my mask on, but I'm still able to kind of disconnect from what's going on and have a peaceful place to study. You can also engage in reading comics or novels, like I said, being in nature, But another component could be indulging in cultural activities. I know I put down trying new hairstyles, but I know like within the Black community on campus, we do a lot of hair events. So a lot of students engage in things like that to kind of de-stress. And that may not seem like a way to de-stress, but it's a great way to kind of wind down and take a moment to just socialize. And you could easily do this over Zoom too. So it's something that's transferable to be online. So there's ways that you can kind of manage everything while also giving yourself a break to kind of decompress and not be as overwhelmed. So next slide. I would also like to introduce Dr. Kennedy to talk about some resources that UAB has for students who may need a little bit more help.
Thank you so much, Veronica. That was just awesome. Yeah, what great, great, great ideas for all the students. And so I hope they were really kind of just taking notes and taking that all in. Yeah, so I am Rebecca Kennedy. I am the Assistant Vice President for Student Health and Wellbeing. And I just really want to run through some of the things that we offer in our Student Counseling Center. So you can see it up here on the slide. We do offer distance counseling appointments, in other words, telehealth. So if you have a phone or you have anything that you can Zoom in on, we can set up an appointment to meet with you. We also do crisis and emergency. Of course, you can, if you need to, you can use that text line. If you are, wanting to talk to a crisis counselor at any time, go ahead and jot that number down so that you can get in touch with someone. We also have lots of different kinds of workshops and trainings. Obviously, the Blazers bounce back. Lots of our students have gone through that and really found some great resiliency skills. Control the controllables. That's a great workshop if folks want to participate in that. The QPR is the question, persuade, refer, suicide gatekeeper training. And then Cognito is another kind of gatekeeper training, a suicide prevention one, but it's fully online. And students, I really want you to consider taking this because I think one of the most stressful things ever for students is when someone they know or someone they care about is having those kinds of thoughts and they do not know what to do. So if you have an opportunity to log on to our website and take Cognito, you'll learn some really valuable skills about what you can do if somebody is struggling. In addition to that, it has a self-care toolkit at the end. And so you can make yourself a self-care plan, which is great. On our website, you'll find lots of different kinds of screenings and online tools in addition to our Let's Talk podcast. So if you get a chance to check that out, that would be great. And next, I think, is Dr. Judd.
Yes, thank you. So, hi, I'm Suzanne Judd. I'm an epidemiologist in the School of Public Health. And it's interesting, 7 months ago, when I told people, my son's friends, parents, my own family, that I was an epidemiologist, most people glaze over or say, oh, you're a skin doctor. All of a sudden, everybody knows what an epidemiologist is. So it's a totally different world that I live in too. If you want to go to the next slide, we can talk a little bit about what does an epidemiologist do. So I'm not the kind of doctor that treats people. I'm not going to treat you if you're sick with COVID. I'm going to look at the data at the population level to see who's getting sick, where they're getting sick, how's it being transmitted, how's it changing. And we have several tools we can use to do that. And lots of them are tools that you all are participating in. For example, we monitor symptoms through UAB Health Check. We've been looking at the COVID-like symptoms in students and faculty, and they've been increasing pretty steadily in October. That tells us that there's probably likely going to be an increase in COVID cases, which is the next thing we monitor. We can figure out where the COVID cases are by testing people. And once we test them, we can isolate them if they test positive to hopefully keep them from infecting others, or quarantine people who have been exposed to a positive person that might then be able to get COVID themselves. We also want to monitor the severity of the disease because there are tons of infectious and chronic diseases out there, but the key is what kind of consequences do they have in terms of deaths and hospitalizations. And then we work with other folks in public health to establish policies that can reduce the transmission to other people, like social distancing and masking. And if you go to the next slide, what we've learned about COVID in terms of transmission, this is a super busy slide, but we're including it in some materials you can look at later. It came from an article in the British Medical Journal talking about what activities really lead to the high spread of COVID. And it's those activities down there in the red, high occupancy places that have more than, say, 10, 25 people, that where people are not wearing face coverings and you're in contact for a long period of time. That's going to lead to the highest risk of COVID spread. You can imagine scenarios like bars late at night where you've got 50, 60, 70 people in there. They might be singing and shouting to be heard over each other, not wearing masks because people have gotten a little bit laid back because maybe there's alcohol being consumed. That's just a very high risk scenario in terms of spreading COVID. On the other hand, if you've got a low occupancy, less than 10 people in a room, everyone's wearing masks, and they're even if they're singing, the spread of COVID is not quite as likely. You're not as likely to pick up COVID from somebody else that's in that room with you. So on the next slide, what we can see is that large gatherings outside can be very safe. You can see here's a great picture at a UAB football game where everyone's distanced, they have their masks on. Even if someone in this situation was COVID positive, it'd be very unlikely they would spread it to somebody else. On the other hand, in the next slide, you can see a rival football team awfully close together, no masks, and maybe some students at a bar, dancing, singing, very close together. These two situations are going to be very risky in terms of COVID if someone at the gathering has COVID. So on the next slide, we can see that the potential to come in contact with COVID really changes based on what the circulating cases are in the population and also the size of the event. That's why you keep hearing those numbers thrown around. This particular slide shows you what happens if you've got a high case rate, which unfortunately is what we're seeing right now in Birmingham and at UAB. We have a fairly high case rate versus a medium case rate and a low case rate. We in Alabama have not seen a low case rate since May. So we've not been in that situation where the probability that you would come in contact with someone with COVID was quite low. So what does the slide say? Here in Birmingham, in the high case rate, if you're at a gathering that has 100 people, there's virtually a 95% chance that someone there has COVID. That's huge. 95% chance someone there is COVID positive. So if you're also doing other risky things like not wearing your mask, in a situation where people might be yelling and shouting, there's just a really high risk you could contract COVID in that situation. Here in Birmingham, even if we only had a gathering of 10 people, which maybe that's you hanging out in your house watching football or listening to music with friends, just 10 people, there's still a 30% chance that somebody there might have COVID. And again, if you start to get lax with your social behaviors, taking off the mask, getting in really close contact with each other, forgetting whose cup is whose, that could run the risk of coming in contact with COVID. Next slide. Right now, there's a 50% chance, as we just mentioned, that you'll come in contact with a COVID positive individual if you're at a gathering of 25 or more. That's pretty substantial. The other thing we know at UAB from all the fantastic sentinel testing that you all are doing is that 1 in 100 students at UAB currently have COVID and they don't know it because they're asymptomatic. Your age group is fairly lucky in that the COVID symptoms are a little more mild than they are for folks that are a little bit older. So people can come in contact with each other and not even know that they're positive for COVID, which again, if you're comfortable and you're taking off masks and being a little lax in social behaviors, then it can be more likely to spread COVID. Next slide. So what determines how bad it will be? I mentioned that for your age group, it's not as bad as it is for my age group, but there are some risk factors that can make it particularly dangerous for your age group. Roughly 1 in 5,000 18 to 25-year-olds will die if they get COVID, if we look at national averages. And what changes your risk of whether or not you'll have a severe case? Well, vaping and smoking are particular risk factors: asthma, obesity, diabetes, genetic lung conditions like cystic fibrosis, and heart disease. But here's the scary thing for an epidemiologist like me, that only explains 60% of the reason why young people die from COVID. We really like that number to be higher. We like to be able to tell people what explains their risk. And a third of the COVID deaths in your age group, just we don't know why it led to a really severe case of COVID. And so that's one of the reasons that we're particularly worried about spread in your age group. On the next slide, you'll see what a difference a week makes. COVID spreads through populations like wildfire. And this is actual UAB data that has been occurring since before you all got to campus. We were tracking how many cases In the summer, students had how many we were hoping we would stay below, which was roughly 21 each week we were hoping to stay below. And you can see here at the end of September, we really picked up in terms of our COVID cases. We jumped above that number of 21, and now we're above 50. And if it turns the corner again, you can see that within a week, we could explode and be up at 250 or 300 cases. That's actually based on real data from other universities that are not so far down the road from us. We know how fast it can spread once it takes root in the student population. On the next slide, we're going to talk about what happens and how we use public health data to inform our decisions. We had a lot of conversations around spring break, and one of the data pieces we used was from student health. We looked at how many respiratory infections when students come back from spring break, what happens in student health. And one of the things we've noticed is that respiratory infections go up dramatically after spring break. This is 2017, 18, and 19. You can see in 2019, roughly, or not roughly, 65% increase in respiratory infections from after spring break to before spring break. And COVID's worse than those other respiratory diseases that were floating around. So we're very concerned about what would happen if students went away for a week and then came back to campus. On the next slide, you'll see there are definitely ways you can protect yourself and others. And this slide's included. You already know most of them because they come from the SHOW campaign. And UAB is doing a lot of these things to reduce transmission, but it's a good reminder of wearing face masks and hand washing to try to slow that spread of disease. On the next slide, you can see what happens if we're not practicing those behaviors that we talked about. Really, the difference between an R of 126 and an R of 1.2, that's in epidemiology terms, the transmission rate. What keeps it at a 1.2, which is where we want it, are you wearing your masks and washing your hands and maintaining distance from your colleagues and fellow students. You can see if that R is at 1.2, that really limits the number of cases we have on campus, so that even if 100 students come to campus initially infected with COVID, if it's not spreading, the cases stay fairly low. And that's what we're really hoping for. And that's why we're always encouraging you to use good behaviors. And now I'd like to introduce Dr. Benoit, the provost at UAB, to talk about what to expect in the spring semester.
Thank you. Thank you all for coming tonight. We're so glad to be able to talk to you as we move into the last couple of weeks of the semester. But I'm also thinking about providing information about what to expect in the spring semester. Next slide, please. Well, I love this quotation, wellness must always be a prerequisite to all else. And you've heard from Dr. Judd that we're using public health decisions and information from public health experts to help us make good decisions about what to do about the spring semester. Next slide, please. One of those decisions has to do with the kind of tools that you have available to keep you safe. So I just want to reiterate what a number of other people have said, using your health check on a daily basis. And it gives you also the green passport that gives you access to places on campus. And then again, the exposure notification app. Next slide, please. If you haven't downloaded the exposure notification app, here's the QR code to do so. And what this app allows you to do is to get notified if you've had a close contact with someone who's positive. So it's a much faster contact tracing device than getting telephone calls and trying to figure out who all you've been in contact with. And some of those people you may not even remember. Next slide. One of the things we know is that students are gathering in small groups, and it's important, I think, to continue to have social engagement. So I wanted to spend just a little bit of time talking about safe ways of having small group gatherings. This information comes from the CDC website. One of the things they suggest is that it's better to host something outside if it's possible, and it will be warm again. We have a couple of cold days coming, but it should warm up. And so if you can do outdoor activities, that's better. If you can't and your activity needs to be inside, it's important to make sure that that area is well ventilated. You might open a window or turn on a fan to make sure air is moving around in the space that you're in. I want to reiterate again how important it is that you don't become so relaxed that you no longer wear your mask. As Dr. Judd indicated, wearing your mask, even in these small group settings, is critically important to reducing the spread. You can arrange the furniture in ways that allow you to socially distance from people who are part of your small group. One of the suggestions they make is minimizing gestures that promote personal contact. And they're talking here about shaking hands, even doing elbow bumps, hugging. Those are kinds of things that right now are probably not a good idea. And then lastly, encouraging guests to bring their own food and drink. Buffet style is not a good idea right now. It has the chance of lots of people touching things that might lead to more of a spread. It's better that people have their own things that they're eating and drinking. Testing for the spring. The plan is that residential students will test during move-in on January 15th to the 18th, and that will be in Bartow Arena, and that we will continue to do sentinel testing throughout the spring semester. And I'll remind you that in order to be part of the sentinel testing, you're required to have an account with Verily. So if you've not done that yet, please go ahead and do that. Currently, you receive a $5 gift card or a t-shirt while supplies last if you come through and do your sentinel testing. And we have this nice photo of Dr. Watts demonstrating how easy it is to do the sentinel testing. Next slide. Again, what to expect. The first day of class will be January 19th. And as Dr. Judd indicated, what we're trying to do there is to take the expert advice from public health and have at least 14 days away from the celebrations over the first of the year. No spring break because we know traveling brings infections back in. We are asking during that spring break week traditionally that faculty not give exams or have papers due during that week to try to reduce the stress during that time. And we've been working with our accreditor to introduce a couple of wellness days into the spring semester. And this is based on some wonderful feedback that we got from Tyler and his organization about how important it is to have some downtime. What we found out from our accreditors is that we can do a couple of these days with the caveat that there need to be assignments that are part of the syllabus for those days. So these might be, for example, a reading assignment that you could do the night before so that you would have the entire day free of other kinds of activities, or it might be posting something to the website. There could be a variety of different kinds of assignments. There needs to be some activity that we can account for as seats being in class during that time. You're in your traditional kind of seat. So we'll have one of those in March and we'll have one of those in April in order to have some relief, some venting. And then lastly is commencement. Commencement is scheduled for April 30th and May 1st. April 30th is the graduate commencement. May 1st are undergraduate commencements. We hope very much to be able to do an in-person commencement and feel like the not having a spring break makes us much more likely to be able to have a healthy and safe commencement that could be in person. So we will have to wait and see what happens in the spring. None of us can predict very well what will occur, but we are really hopeful to be able to do that. We know how important it is to celebrate all of your wonderful accomplishments. I want to echo what Tyler said at the very beginning. I want to congratulate you on your efforts so far. We know that this is a very difficult situation, but you've really risen to the challenge. Next slide. I'd like to introduce Dr. Michael Sag. As I indicated, predictions are always difficult about what's happening in the future, and he's going to talk a little bit more about that. Dr. Sag?
Thank you very much, Provost Benoit. So the most common question that I get is, this has been horrible. When is it going to get better, and when is this going to be over? So I think back to this comment, predictions are always difficult, especially when they involve the future. This quote originally kind of came from Niels Bohr. For those of you in chemistry and physics know that he had a lot to do with probability and estimates of where things were. But I'm going to use a different helper as I go through this talk. Next slide. And this guy's name is Yogi Berra. Yogi was a baseball player on the New York Yankees in the 40s and 50s, quite a character. And he came up with this and turned it around into a popular quote. But Yogi Berra was most known for all of his crazy quotes. And a lot of them are really pretty insightful. And so I'm going to use him to help us go through this, and I'll explain what's going on. I'll also try to answer a couple of the questions that I saw submitted ahead of time on why we keep going through the same rising cases that keep happening over and over. Next slide. So everyone's talking about surges. I'm not sure we're actually seeing surges. I see this as almost a stair-step increase in cases. And we are going through this over and over and over again. One of the questions I thought that was very insightful was from somebody who had served in the Army and said that he or she had served with nuclear waste and other things and had to wear suits to protect themselves, and asked the question, why is it so difficult for people just to simply do these simple things that you've seen that we talk about with mask wearing, social distance, washing hands? And I can't answer the question. That's not a prediction. That's just a shrug, because I think we all, as a society, at least in the United States and somewhat around the world, are just failing to do simple things. But I'm very impressed with what I'm seeing happening on our campus. You guys, the faculty, the staff, are doing a pretty darn good job of following these things, but the general community around us, not so much. And we just got to be persistent and try to help people understand the value and importance of this. And if we pull together, we can stop this stair step and bring it down. So let me give you some other examples. Next slide. A lot of you who've taken classics or philosophy know who this is. This is Sisyphus, who was a king of a certain region in Greece, and according to Greek mythology, kept for the rest of eternity, because of his boastfulness and his conceit, was sort of damned to roll a stone up a hill, and right as about he got there, it rolls back down and he's got to do it all over again. And that's kind of what I feel like is happening to us as a society. We do a little better when things get bad, and then it rolls back down and we start over. But whatever we can do to help educate the community will be very helpful. Next slide. Yogi would say, the future ain't what it used to be. And that's unfortunately where we are right now. We'd love to be back to 2019, and 2020 ain't what 2019 used to be. So what can we do and how can we look at this? Next slide. As I mentioned, the cases are going up everywhere. I think 44 of the 50 states are having important increases in cases, most notably Wisconsin, North Dakota, South Dakota, other places. And the challenge for us is not even so much the cases and the illness and even the death, but it's the overwhelming of hospital systems. And you see that hospital beds are coming into short supply. And that's a big concern to all of us. Right now at UAB, we're kind of stable. We're concerned, we're vigilant, we're trying to make sure we're ready for whatever might hit us. But if we could just get in lock sync with the community around us and get people to start doing those simple things, I think we can bring it under control. And next slide, you can see that some places in the US have done that well. Look at New York. That's a good one on the far right-hand side. Big, enormous amount of cases in April. And look how well they've done since then, because they pulled together as a community and did all the things like you're doing on campus right now to keep it under control. So it can be done. We know what needs to be done. We just don't know how to implement it across all 50 states right now. Next slide. And so, yeah, it's like deja vu all over again. And we see things coming and going, and it's like, haven't we been here before? Haven't we seen this surge? And the answer is yes, Yogi, we have. Next slide. So why is this happening? First, COVID fatigue. The community around us is just flat out tired of dealing with this. They're tired of hearing about it, and you're probably tired of hearing about it even on this call. Next. There's also some mixed messaging going on. We're in an election year. Things are kind of crazy right now, especially over the next 6 days. But we're getting false facts like things like masks don't work. They do work. Next. You can see from this graphic that if you look on the x-axis on the bottom, the percentage of people wearing masks in public, so off to the right, the people that have worn the masks the most, and you see in the community, have the fewest number of cases on the y-axis. So those states that are not as good about wearing masks are suffering more in terms of new cases. Next slide. Next. All right. And then there's the concept of herd immunity, the thought that, well, if everybody gets it, once we get to 240 or 250 million people, then we'll be safe. Well, no, we won't. And the main reason for that is twofold. One is that having this does not assure that you won't get it again 4 to 6 months from now. And secondly, if we got to 240 million people infected, we could have anywhere between 4 million and 6 million deaths. So that's unacceptable. And then misleading facts. We hope a vaccine will be here soon, and it might be. But then again, it might not be. So that's a prediction we can't make. The vaccine's either going to work in the phase 3 studies or it's not, and we just don't know. And I think another problem is that we've had disruption of the trusted voice. People who normally we turn to in times of difficulty, for example, CDC, social media, other places are undermining their messaging and making it difficult for us. So next slide. Whoops. So this is kind of us wearing a mask trying to keep the onslaught of cases away. And I'll finish with another Yogi Berra quote. It ain't over till it's over. And that's absolutely true. And when that'll be, I don't know, but seriously, to help you brace for this in all kinds of ways, I think we'll be dealing with this, even with the vaccine, certainly through the spring semester and probably coming back to school next year. We might see it better next year and maybe even before, but let's just brace ourselves for the fact that it's going to be with us a while longer. And the better we deal with it, the better we work together, the better off we're going to be in terms of managing this and keeping all of us safe. So I'll turn it over to Dr. Faircloth, who's going to talk to us about student testing information.
Thank you, Dr. Sag, and welcome, Blazers. I'm going to talk about testing briefly. I thought it would be useful to talk about the types of testing. First is viral testing. It's to detect the virus itself by identifying genetic material or proteins called antigens. The purpose of both is to detect if acute infection is present. You can use it in those who have and those who do not have symptoms. One platform is molecular genetic testing. More commonly, you hear PCR that detects RNA. It has both a point of care rapid test that is done in-house and results in about 30 minutes, and another platform that you send to a reference lab that results in about 24 to 48 hours. The second platform is an antigen testing that detects proteins on the surface of the virus. It is a point of care in-house rapid test that results in about 30 minutes. Sampling for both of these can be a simple nasal swab or the more invasive, painful nasopharyngeal swab. The second large grouping of testing is antibody testing. It detects previous infection by measuring the body's immune response or antibodies to infection. It's again for those who have and do not have symptoms. Next slide, please. The antibody is not recommended as the sole test for diagnosis of acute infection. You would either need to supplement that with a PCR or an antigen test. Antibody testing is most useful currently for public health surveillance and epidemiologic studies. Next slide, please. Next, I want to talk about testing strategies. Symptomatic, we're trying to detect infection in those who are ill. We can use either the PCR or the antigen platform. Asymptomatic testing has two broad categories that we use on our campus. One is sentinel testing that you heard about. That is a systematic randomized sampling of a set percentage of a population on a repeating basis, for example, weekly. We are proactively monitoring the campus for asymptomatic spread in order to discover unseen transmission. It can signal trends, identify outbreaks, and monitors the burden of disease in a community such as our campus community. Students are required to, if randomly chosen, Some students are required to participate in the sentinel testing, those who are living on campus in housing, athletes, clinical students, and those in registered student organizations and Greek life. The remainder of the general student population is voluntary, but certainly we encourage you to please participate if you're chosen. What is required for all students that Dr. Benoit mentioned earlier is any student that will be on campus for any reason should create a Verily account so that you will be represented in the bucket or population that can be randomized. That allows us to more accurately have a statistical representation and then achieve those goals that I mentioned above for the testing. The second large asymptomatic testing group is for-cause testing. Next slide. This is testing a cohort of people within a common geographic area or group when there has been an increase in positive tests or symptoms within that defined area. Again, it's voluntary for many students, but for those students that are required to test in sentinel testing, you're also required to test in for-cause testing. Inside student health, we offer both the point of care rapid antigen testing. This is the little unit that we use. It's a Quidel Sophia antigen. It results in about 30 minutes. It has a 98% sensitivity, so it's an excellent test. Next slide, please. We also send swabs out to a UAB lab that does PCR testing. They use this Aptima SARS-CoV-2 assay. It has around 100% sensitivity, so it's a little bit more accurate than the antigen testing. Usually results come back within 24 hours. Sometimes it's 2 days. For both of these tests, we have the student self-collect. Sometimes, occasionally, a clinical personnel will help the student or do it themselves. It's not painful. It's not the nasopharyngeal swab that you hear about. Importantly, we offer every student an opportunity to test at Student Health. So every student, we have a conversation with either a clinician or a nurse about the pros and cons of testing. And then we have a shared decision-making process. But in the end, if a student wants to be tested, we're going to test that student. For symptomatic students, almost all symptomatic students are encouraged or recommended to be tested, and most do. Asymptomatic students depends on the student's unique circumstances and experience, and most of those end up testing, but not all. For example, as we get closer to November the 20th, and many of you are going to be going home and not returning, I know some of you may want to be tested before you go home. For example, you might have a parent or someone at home that's high risk and you want to know if you're positive. Just contact Student Health and we certainly can talk with you about that. The ways that students can get tested inside Student Health, the most common is a yes response on health check, either to symptoms or a potential exposure. You can call Student Health and speak to a triage nurse, portal message. It could be through a visit with a clinician, a nurse practitioner, or a physician, either in-house or virtual. Or you could be reported to us as a potential exposure contact, and we reach out to you to talk about testing. You can call Student Health at 205-934-3580, the patient portal at studentwellness.uab.edu, or the website at uab.edu/students/health. I'm going to turn it over to Dr. Lori McMahon now, the Dean of the Graduate School. Thank you.
Good evening, Blazers. We are so happy that you've tuned in to listen this evening. I would like to share a few pieces of important information with you about closing out the fall semester. But before I do that, as you've already heard from Tyler and Dr. Benoit, we all congratulate you for your efforts this fall. You've worked really hard on your studies. You have been resilient. This is a complex time. We all feel it. We know you feel it. And we are so proud of you. And you all should be proud of yourselves too. You've accomplished a lot and you've made it through your exams, you've made it through midterms, and now we're looking toward finishing this fall term that you can have as progress towards your degree. So next slide. So a couple of really important pieces of information are listed here, and this is regarding health check. All of you have been participating in health check every day, logging in no symptoms or some symptoms. Those of you who are finishing in-person or hybrid classes on November 20th and maybe moving home to family or moving out of the residence halls or your apartment and moving home to family, you do not have to continue daily health check. So beginning November 21st through January 11th, you are not required to participate in daily health check. And it's really important to know which group you're in. So if you are an undergraduate or if you are a non-thesis or online master's student, you will have a break from daily health check. You will be asked and required to restart health check on January 11th. For those students who are continuing to live in the residence hall or students enrolled in 698 or 699 non-thesis or thesis master's research, or if you are a doctoral student registered in 798 or 799 doing non-dissertation or dissertation research, all students in clinical and professional programs, and all students in athletics, you all have to continue doing daily health check throughout the break between the fall semester and the spring term. So students who are moving back into the residence halls will participate in re-entry COVID testing. The dates will be January 15th through 18th, and that will take place using the Verily system, and that will be in Bartow Arena. Next slide. We understand that many of you are concerned about taking your final exam. And we know that some of you live in places in our state or even outside of our state where your Wi-Fi access may not be stable and you may have concerns. Those of you who are living close enough that can return to campus, there will be spaces available that you can register for beginning 2 weeks before final exams. Those spaces are in Lister Hill Library and Stern Library. We really recommend that you look at Stern Library first. There are many spaces, approximately 60 spaces available in Stern Library. That you will be able to register up to 2 weeks ahead of time, and you will be able to reserve a 3-hour block. Now I'll pass it to Mark Booker to share information about housing.
Mark, you're muted.
Thanks, Dr. McMahon. Good evening, Blazers, and welcome in. Thank you for being with us tonight. It's a pleasure to be able to talk with you a little bit about the end of the fall semester and the spring for returning students to the residence halls. I know you have a lot of questions, and I try to address some of those through my slides. As you know, November 20th is the last day to be in the residence halls. We know that you have work to do after the 20th, and that doesn't mean that classes are over, just the in-person portion. So please be thoughtful about what you want to take home and ensure that you take home your chargers and your laptops, your textbooks, notes, anything you may need to finish the semester. We learned in the spring that many of you did not take everything you needed, so please be sure, be thoughtful about that. Medications, any prescription medications you may be taking, please take those items home. It's important for students that do wish to remain on campus after the 20th that they sign up for housing as soon as possible. One reason that that's important is that we are going to disable access to the residence halls after the 20th to maintain a safe and secure environment. As you know, we have not required students to pack their things and take them home as we originally planned. So we want to keep that environment safe for our residents. The fall meal plan will end on November 20th. Depending on the number of students who remain after the 20th, we're making decisions about what to offer in campus dining. And as soon as we have good information and can make informed decisions based on the number of students who are left, we may require a meal plan for the period after the 20th through the 11th of December. Next slide. For coming back, you've heard already that we will reopen on January 15th at 8 a.m. in the morning. Everyone does not need to return at that time. You'll be getting information over the holiday period and break about how to return and how to sign up for a return time. Again, knowing that you don't have to move everything in, you won't need as long to move back into the residence halls in the spring as you did in the fall. So we're going to offer probably 30-minute to an hour time blocks for your return. Please plan to be tested the day that you return in a close proximal time to the time that you pick to move back onto campus. And the reason that that's important is that we want you to sign up through the Verily that Dr. Faircloth mentioned account to get your time for your testing and pick a time to be back on campus that day. Athletes, if you need to come back to campus early before the 15th, please work with your coaches on that. We're working with many coaches on teams to do that and plan for that as well. And we've talked about our testing and also re-engage our daily health check on the 11th. So thank you for your time and good luck on the rest of the semester. I'll turn it over now to Jasmine Benjamin with the Graduate Student Association. Jasmine.
Hey everyone, I want to echo a lot of the earlier sentiments and not only congratulate you for having a really successful semester, but also thank you for participating in health promoting behaviors so that we could keep campus open and complete this semester. While the semester is coming to an end, COVID is not. And a lot of the things that we're doing right now will extend, as Dr. Sag said, well into next year. So while I know that we all are experiencing varying degrees of COVID fatigue, this is kind of our new normal. And so while I do thank you for participating in those health promoting behaviors, I hope that you'll commit to continuing to do that even throughout the break from classes towards the end of this year and the beginning of next year. Obviously there's no spring break, and I know that's kind of a sore spot for a lot of us. And I know that for some of us grad students, we really don't get a fall or winter break either. For those of you that are traveling over the holidays, please continue to show your Blazer spirit and stay 6 feet apart from those that are not in your quarantine pod or part of your family. Wash your hands, be responsible for your health promoting behaviors, and as always, wear a mask. For those of you who are staying in the area and continuing with research or kind of just not putting your family at risk or anything like that, please do take some time for yourself. Do some of the self-care behaviors that Veronica mentioned earlier, and spend some time with your friends in a safe manner, of course. In closing, definitely do use your health check. I know that if you're not a grad student, it's not required, and some of you may be getting a little frustrated with the text messages we're getting every day. But just like a lot of the health promoting behaviors that we're using, these aren't just for you. They're for your fellow students, they're for the people in your community, they're for your family as well, and your friends. And that's all I have. So I'll pass it over to Dr. Judd, who's going to give us a couple of remarks about Halloween coming up.
So you all know Halloween is Saturday. I probably don't have to tell you that. There are a lot of things you can do to keep it safer. Remember that those Halloween masks don't protect you. You've got to wear your mask under your Halloween mask, or wear your mask as a part of your costume. Find a way to make it fun and decorative. Stay with your friend group and keep it small. One of the challenges we have here is that we don't get a ton of regulation from our state in terms of limiting our gathering sizes, but I can tell you states across the nation are saying no more than 10 people, no more than 2 households. That's a good rule of thumb. 2 households means if you live with 2 people and you get together with another apartment that has 2 people, that's 2 households. So you're looking at a gathering of 4. Consider getting takeout instead of going to a restaurant with your friends or to one of those spooky Halloween gatherings. Keep it small, keep it safe. And why Halloween? Why do we bring this up? Well, number 1, it's a Saturday, so that makes it more likely for people to want to go out. And number 2, what happens this Saturday will seed the next 3 months. This is it. For an epidemiologist, this seeds it. Basically, the infections that happen on Saturday will start to peak in 2 weeks. And I don't know if you're looking at the math, but that's right when you all go home to be with your families for Thanksgiving. Your families that have older members of the family that are at risk for severe complications of COVID. That means that whatever we do this weekend, that sets us up for the next 3 months, for Thanksgiving, for Hanukkah, for Christmas, for New Year's, and it could determine the whole fate of your spring semester. Not to be dramatic, but again, that's the way an epidemiologist looks at it. We look at what can cause extreme growth going up, and Halloween has us all very nervous. We'll be watching to see what happens and hoping that students don't, not just students, but young people and young families, that they don't hold large gatherings that increase the number of cases that we already are seeing circulating in the community. And with that, I think that was the final slide we had.
Now we're going to pass it to Dr. Jones, who has closing remarks.
First, Blazers, thank you for attending and thank you for making the campus community healthy and safe. On behalf of the Division of Student Affairs, good evening. If we haven't met, my name is John Jones and I serve as the Vice President of Student Affairs. During this pandemic and since March of this year, under the leadership of Dr. Watts, I had the privilege of serving with talented, passionate, and dedicated experts and professionals committed to creating a healthy and safe university community while fostering student success. As you have seen from the information shared this evening, UAB experts and professionals have demonstrated excellence while tirelessly guiding you in making decisions to keep you, your family, friends, and the community safe. My closing comments will focus on providing some general information on the spring semester programmatic themes that are designed to foster a sense of belonging, enhance student engagement, and advance student development. But first, if you're still unsure, I want to highlight why this virtual town hall meeting is important. I will use the analogy from the technology world about receiving frequent requests to update software, applications, or operating systems. Software updates offer plenty of benefits, including to repair security holes to keep out hackers. Updates remove viruses that prevent your device from operating efficiently, as well as prevent that viruses from spreading to others. In short, software updates ensure that your device is operating at the highest level of security and safety in order for you to receive the maximum benefit. Navigating this pandemic is similar to the technology update as an analogy. Our goal as a university is to be the epitome of excellence and to develop students into the best version of themselves. Throughout the semester, from classroom instruction, experiential learning, or out of classroom experiences, students' internal operating system, i.e. their mind, which is the manifestation of thought, perception, emotion, determination, memory, and imagination, has gone through several updates. Again, similar to the tech world of offering software updates, this virtual town hall was designed to, one, update you on the public health data that influence the campus leaders' decisions. Two, update you on the use of testing that not only keep you safe, but minimize the spread of COVID to you and others. Three, update your mental health well-being and self-care that enable you to operate more efficiently. And four, update you on the action steps to safely finish the fall semester and to successfully start the spring semester. In short, these updates ensure that UAB is operating at the highest level of health and safety in order for you to receive the maximum benefit of developing the best version of yourself. So with that in mind, here are the programming themes and updates for the spring semester. First, we will continue to provide programming that embraces and serves the safety practices and protocols advised by UAB world-renowned medical and public health experts. We will also continue to enhance our focus on student well-being and health strategies, especially surrounding typical high-stress times. Although the academic calendar for the spring semester has been adjusted, at least 10 departments within student affairs, such as counseling services, student health services, and student involvement and leadership development, will continue to operate their spring semester signature events. And as always, we will use data gathered from student surveys, focus groups, town hall discussions, and other meetings to inform our programmatic offering. Lastly, we will focus on the successes of the students, especially during a difficult and unusual time. We strive to provide appropriate and safe outlets that allow students to de-stress and take breaks from the rigors of study. In closing, at UAB, we are committed to excellence, accountability, and student-centered success. I look forward to continue to work with the experts on this panel and at UAB in providing a healthy and safe campus environment, and again, assisting you all in achieving the best version of yourself. And as always, be healthy, safe, and kind. Go Blazers. With that, I turn it back over to Rosie.
Thank you, Dr. Jones. All right, we just have a few minutes left, but we want to take a couple of questions. Some of you pre-submitted questions over the week. So the first question we have is a student wants to know what we're doing to accommodate voting on November 3rd. Will we cancel classes? So I will pass that to Dr. Benoit and Dr. Jones.
So on October 11th, there was an email that was sent out to all faculty and staff. And what we've asked is that faculty be very flexible with students. We know this year the lines may be longer. Try to arrange around your classes, but but we've asked them to be very flexible, knowing that this is an important civic responsibility that each individual is doing. The same thing for faculty and staff. We've asked their supervisors to be very flexible with them as well, so that everyone can get out and vote. So please make sure that you have a plan about how you're going to vote on November 3rd.
Thank you. A student asks, what will be happening to lab research or shadowing opportunities? Will there be any in-person in the foreseeable future? So maybe Dr. McMahon, I don't know if you want to take that.
Yeah, so the shadowing opportunities, the students need to get permission through the clinical departments, and they have an approval process. I'm not aware that that's happening right now, but reach out to your advisor to get help with contacting those individuals in clinical departments for those kinds of activities. As far as research goes, research is being conducted right now and will continue after November 20th when we move classes to the remote format. So those students who are engaged in research intensive programs will continue their research. Undergraduates who are also approved to do research, and if they are living in the local area, they can continue their research, but that will have to be discussed with your research mentor how that will proceed after November 20th.
Okay, we'll take one more question here. An individual asks, with regard to the people who have already contracted the virus, are these individuals still potential carriers of the virus despite their own current immunity? So I will give that to Dr. Watts or Dr. Faircloth.
Yeah, I'll be glad to answer that. When a student or someone has contracted the illness and they become asymptomatic and they've been in isolation for 10 days or 10 days plus the 24 hours until they're not symptomatic and don't have fever, they are then considered immune. And at least for some period of time, they're not going to be infectious. That doesn't mean, and we don't know yet about 6 months or a year later, but at least for some period of time, they should be protected and not infectious.
Okay. And then one last question. For the return to campus testing, will students have to quarantine in their dorms while they're waiting results? Dr. Faircloth or Dr. McMahon?
Yeah, I think students will be encouraged to get their testing and try not to be about as much as they can. I don't know that it's a requirement that you don't leave your room, though. I just think that we'd encourage you to remain in the area of that room as much as possible.
I would just like to reemphasize that students who are moving into the residence halls, you will be signing up for a time to move in to the residence hall. And on that same day that you move in, we would like you to sign up through Verily for your re-entry COVID testing that will take place in Bartow Arena. So the hope is that your testing happens the same day that you move in, and we aren't requiring a quarantine during that time.
Great, thank you. We are over time, and many of you sent in some questions beforehand that I think we've answered most of them. Some questions have come in today. We will seek to answer those questions, and I would say look in your next green mail. Open that green mail and we will have answers to the questions that you posed here. But with that being said, I'm going to pass it to Dr. Watts for a closing.
Well, thank you all for joining us tonight, and thanks for all of our participants. Very informative evening. I hope this has been helpful to all of our students, and we want to make sure that you are as safe as possible, and we're going to do everything we can to help you have a great experience on campus as well. So good evening, everyone, and be safe this weekend.
Thank you.